And welcome once again to Community Viewpoint. I'm John Pawlak, your host for the segment. And with me today is Ryan Muccio. And Ryan and I are going to, I finally got the t-shirt to the right program, the RAM. We'll be talking about RAM today. RAM is the Remote Area Medical event. Ryan is the co-chair of that, along with Stacy Smith from the Nye Communities Coalition. And it has been here, it's going to be 6 years. How do I know that? Because I have t-shirts, all different colors from every year.
John, I see a White Castle t-shirt in there.
Oh, wait a minute. Yeah, sorry, I'm sorry about that. But anyway, they're from every year. So unfortunately, this year, it's going to be purple. I try to get tie-dye. Every year I try to get tie-dye, being an old deadhead, but they wouldn't do that, so they gave me purple. But anyway, this will be the 6th year, and Ryan's going to tell us a little bit about it. There's a lot to talk about because it's such a wonderful service to the community. And where do you want to begin?
Well, I guess we can begin from the beginning. About 6 years ago, Stacy Smith, who was the CEO of the coalition, had the great idea of trying to bring a RAM clinic here to Pahrump. She had been involved in RAM in Las Vegas for a couple clinics. They no longer host those clinics, so it was natural to want to try and host one out here. And Stacy came to me and I said, let's do it. So 6 years later, here we are. And like you said, this will be our 6th clinic. They've been very successful. We've been able to help a lot of people. And this year we should surpass, we will surpass over $1 million in care to the Pahrump and surrounding communities.
So the RAM, the Remote Area Medical, is a major nonprofit provider of free mobile clinics. I'll read from the message here. It has a mission to prevent pain and alleviate suffering by providing free quality health care to those in need. They do this by delivering free dental, vision, and medical services to the underserved and uninsured individuals. So that's your basic premise of that.
Yeah. Our clinic, in addition to the medical, dental, and vision, we actually also offer mental health services. So we have psychiatric and mental health professionals on site. And so that's been a great addition to our clinic also. And the services that are available, there's a plethora of services, and they range from tooth extractions to eye exams to general medical physicals, checkups, wellness checks, whatever you need, we try and get it done at RAM. And you can, in the vision area, you walk away with a pair of glasses that same day in most cases, which is impressive. So we have an on-site vision lab that actually cuts and makes the glasses right after the doctor writes the order.
And it's a no questions asked clinic.
Yes.
Event. You can live any place.
Yep.
You could be rich, you could be poor. Many people have come there and have some sort of medical coverage, but they're maxed out on it. So if they need more glasses, they've broken their glasses.
Yeah.
They can get another pair. Things like that, and no questions asked, basically.
And that's important to know, because it's we have a lot of people who I think are ashamed to come or think, well, we should save it for somebody who's maybe less fortunate as me. And that, unfortunately, in America, with our healthcare system as it is, that's not the case. And I'm fortunate to have fantastic insurance, and I still only get one pair of glasses a year. And so what happens when you break that, or what happens when you need dental work that's not covered under your dental plan? And so I try to tell people it's not just for people who may be less fortunate than you, it's for everybody. And we don't ask any insurance questions at all, or any income requirements. So
I was, you just talking about glasses. I remember 2 things happened with me in the last maybe 3 years ago. Number one, my eyes stabilized. It's the same prescription. And number two, my wife taught me how not to put my glasses down,
Right.
glasses face down. They last a lot longer. They lasted 3 years, the same pair.
There you go.
So a little bit of self-care helps the glasses go a long way also. But you may lose them.
Sure.
The dog may take them. The car may run over
Had
them.
that happen, and
Yeah,
that.
yes. But it's a godsend, though, to have these people come here.
It is.
They're based out of Tennessee?
Yeah, yeah, right outside of Knoxville. And they're really a humble group.
Oh my God, yeah.
They're such a fantastic group of people that come with RAM. They travel all over, primarily the United States now, but really all over the world. They just recently responded, I believe, to the bad hurricanes down in Florida. They do just a lot of different work that is just so needed in the country.
And they have a whole different setup now because of COVID-19.
Yes.
We're going to show you a little video here. And they have, what do they call operatoriums?
Yeah, the operating bays for the dental.
But the chairs would be set next to each other, spaced apart so they wouldn't be interfering with each other. But now they're in a separate booth because of COVID-19. What we'd like to do now is show you a little video made by the people from the RAM, and then let's see if we can run that now.
A lot of these communities here, they don't get a lot of care that they need. They don't have access to care.
There's so many people out there without insurance that can't afford them, and they need help.
There's a lot of people that's suffering because they can't afford to go to a doctor because they can't afford the insurance.
Without this sort of an event, they wouldn't get the help.
You can't put a price tag on what we're doing in these clinics and the care we're giving and the impact it has on people's lives.
Remote Area Medical is it's a nonprofit. We travel around and we set up mobile medical clinics. We do these around the country from coast to coast, and we provide all the services at free of cost to the patients that are coming through the doors.
Originally, of course, Remote Area Medical was organized for the purpose of going to third world countries. I found myself in a place in South America called British Guiana, and I was very badly injured. They pulled me out from underneath the horse, and one of them said, well, the nearest doctor is 26 days on foot from here. And so that was really the beginning. Eventually learned to fly an airplane. I was able to fly in medical supplies. Came to the conclusion that maybe we needed to bring the doctors a little bit closer than 26 days on foot. Years later, ended up here in the United States. And to my surprise, I found that there were millions of people that didn't have access to the health care that they needed.
RAM is important because it fills a gap. The need for health care is out there across America, whether you're in Appalachia or whether you're in Los Angeles. We see the same thing from community to community.
We brought it to the community knowing there was a need, but not having any idea how great the need was. It wasn't a question as to whether or not we would bring it back.
These clinics are designed for locals to come through the community. They're able to receive medical, dental, or vision care.
Even though many of them are working, many of them have health insurance, that's an area that's not covered by insurance for many, many policies.
This is wonderful. I mean, to have something like this, to provide the health care that people need to prevent tooth loss, to prevent breast cancer.
Free health care, totally free, no questions asked.
It's really going to change their lives, and it's going to change their lives in a good way for a long time.
RAM is an opportunity for someone to give back and to take part.
I was so impressed with the first clinic that I went to. I came back a renewed person. I would strongly encourage all medical professionals to consider volunteering. Here you are free to provide medicine and give the very best care you possibly can to people who truly need it.
Even if you have no medical experience, you can come into a medical clinic and provide a service that really touches the lives of people.
What we do, of course, is a very expensive operation. Our support comes mainly from those $10 and $15 donations from the general public.
To get involved, it's actually through our website at ramusa.org. Someone can sign up as a volunteer. Again, they do not need any medical experience.
It's a real privilege to work with Remote Area Medical. I'd like to invite you to volunteer at future clinics and fund future efforts by going to ramusa.org so together we can make an impact in our communities. And thank you again.
So that was interesting. There were some scenes that were filmed here in the past, prior to COVID, because the operatoriums or whatever they called, they were not enclosed, and they're all the ductwork there to suck the air out and filter it and everything and it's very, very sterile and it's very clean. And when you go in there, you're you're taken care of, and it's very you don't have to worry about any germs when you go over there. Now, going in there this year, they're going to be going in there. Oh, when's the date?
Yes, so it's the first weekend in October, that first Friday and Saturday. Or excuse me, I'm sorry, that first Saturday and Sunday. We used to do 3 days, so we're switching to that, switching back to just Saturday and Sunday. We found it a little difficult to get medical providers on Friday.
On the last day of the week, yeah, because they're making money in those days, and
Right.
they're providing services for the people.
Yeah, so October 2nd and 3rd.
Yes.
Yeah.
And they come in a lot of times, and if not from here, then from Las Vegas, different schools from UNLV, whatever it is. But we appreciate all the volunteers, whether they're grunts like myself or the optometrists, doctors, dentists.
Yeah, quite a bit.
So Stan Brock, who has passed away 2 years now?
I think it's been almost 3 years.
I'm getting old.
Yeah.
So he gave you it's www.ramusa.org. That's how do you volunteer for our own?
Yep, so you go right to ramusa.org and you can click on the clinic schedule, and there's also a volunteer with us button, and so you'll just click on that, find the Pahrump clinic and register online.
Oh, okay.
Yeah.
So it should be relatively simple like that. So we're done for this segment, so it looks like we may be doing another segment. So we'll see on the other side of the commercial or whatever. And welcome back to Community Viewpoint. We're still John Pawlak and Ryan Muccio.
Still here.
Yeah, I'm still your host, and he's still the co-chair of the RAM. So nothing's changed since the last minute. But anyway, we were talking. You got an earful earlier about the RAM event, the Remote Area Medical event, and we didn't tell them where it's going to be.
That might be helpful.
It changed. Was it 2 years ago it changed?
This will be our 3rd year at Pathways, yeah.
I know. Yep. I caught up on that one. But we started out at the Nine Communities Coalition, and it was almost the perfect fit until we found the Pathways.
Right, yeah. Yeah, so we're now holding it at Pathways, which is actually technically I think called the Innovative Education building. So it's right there on the corner of Mount Charleston and Calvada on the Pahrump Valley High School campus. It's not at the high school, so it's at the Pathways building on the corner. And it's much better. The coalition was great, but we outgrew the coalition, and so this is and it's also a little more centralized. So as far as all the services being together in one building. So happy to have it there, and that's exciting.
Yeah, so that's going to be, I believe it's the 2nd and 3rd of October.
Yep, Saturday and Sunday, the 2nd and 3rd.
And I was going to ask, are we going to ask for people to wear masks going in?
Yes. Yeah. So as far as what I've gotten from RAM so far, and this is subject to change, but we will require masks, and I believe it will not matter if you've gotten the vaccine. You'll still need a mask from what I've been told so far, and still following very strict COVID protocols to keep everyone safe.
Because unfortunately, there are reasons for that, because we happen to be on the bottom of the list as far as COVID people becoming
Vaccinated.
unvaccinated
Right.
people being sick with that, and we're the bottom of the list of people getting COVID-19.
Right.
So we're just going to go and think that everybody's going to have masks on to be safe, if not for them, but the person next to them and the caregivers that are over there.
Correct.
It will get better one of these days, but it won't get better until everybody is vaccinated.
Yep.
And
we will be offering COVID vaccines.
That's right. We talked about it at the last meeting.
Yep. So we'll be offering those, which is exciting, and I believe a flu shot as well. We're still kind of working out the details on that, but we will definitely have COVID-19 vaccines on site.
Is that with the health nurse?
It'll be
county?
Yeah. So it'll be with Crystal over at the county health nurse in collaboration with RAM and the coalition. So we're excited to be able to provide that.
Because they are giving those vaccinations now. And the county health nurse down here, the phone number there is 775-751-7070. So as you're going down Calvada, going west, there's a big sign pointing you to the nurse.
Get your vaccine.
Yes.
Yeah, you know, John, I work in healthcare, and I witness a lot of the effects of COVID, and we're really seeing that with the vaccine. You're getting less sick if you do get sick. So a vaccine is never going to prevent you from 100% getting it. But if you're unfortunate to get it and you're vaccinated, the numbers and everything right now is showing that you're getting way less sick, not needing to be hospitalized. And certainly the death rates are lower. So we're really encouraging and strongly encouraging that.
So I'm in the group that would be first hit the hardest with COVID-19. My age, I'm missing body parts in the inside, and body parts that don't work, like a lung. So those things, my age, yes. So I made sure I got vaccinated earlier.
Great.
And also the VA has been taking care of my flu shots for many years, and that's another thing that they didn't have to do it last year because we didn't have much of a flu season. And I think that was possibly because of this. And then my wife taught me how to clean my hands.
There you go. Yeah, it's been a crazy couple of years with it, and we're rolling with the punches, but I'm happy we are still able to hold our RAM clinics. And you know, RAM and as the organization has done I can't even explain the amount of work they've done to make sure that everyone is safe, and they have used best practices, and I say they're doing even better than the best practices. They leave no stone unturned when it comes to safety and those protocols, so I feel very comfortable about it.
So let's look at how the people are going to register to get in. We had one way of doing it in the beginning, and now that's changed?
It has a little bit, again, because of COVID. So we don't want large congregations of people. So in the past, the line would form, a significantly long line overnight. People would camp out and wait for services and then get a ticket. So it's a little different now, where the parking lot will open at midnight. You'll come and you'll get a number, and you'll just go park in your car, and then we'll be calling those numbers into the clinic on an individual basis as space and social distancing permits.
And we will have porta potties there, so
we'll be
have
passing
services.
out snacks and water, and
Will I be
no
doing
snacks
that?
for you.
No, because I'm working nights.
You'll be the snack passer outer.
Yeah, here.
Just don't eat them all.
Yes, no, I don't. I won't.
So we'll try and make it as comfortable as possible, but we do encourage people to get there, as soon as they can. Again, the gate will open at midnight the night prior, so it'll be open Friday at midnight. It'll open for the Saturday, and then Saturday at midnight will open for Sunday.
So let's go over that again. So they come there at midnight?
Yep, show up at midnight. You certainly don't have to show up at midnight, but we recommend that if you want to secure a spot.
It's 0 hour, okay.
Correct, yeah. So it is first come, first serve. We make no promises that you'll get seen, but we do our best to try and get as many people seen as possible. So you show up, just bring some blankets and some pillows and kind of sleep in your car, and we'll open up the clinic in the morning at 6 a.m. and we'll start calling in numbers and having people come to your car and gently wake you up and invite you in.
So we're not going to do the 3 o'clock thing, hand out tickets like we did before?
We're still kind of ironing that out. We'll make sure we release that, but we have a meeting next week with finalizing some of those details. I'm not a fan of that. I think once people get in and get to sleep, we should be able to let them sleep, and then. But RAM has a way that they do it, and it works, and so we'll respect what they do, and we'll figure out how we're going to do that this year.
Okay, and this program will air a couple of 2 or 3 more times prior to the beginning of October when we have the clinic, to remind everybody, and I'll have an addendum to update you on any new items that we didn't cover today as they become available to us.
Stuff's always popping up. Even this last week, we just formalized a partnership with the state Health and Human Services, who's going to actually be coming out 2 weeks post-clinic, so 2 weeks after, and providing follow-up services. They're going to have a doctor and some nurses, and so if anybody came to RAM and they got services and they need follow-up after that, then that service will be provided for free 2 weeks after.
Well, that's interesting.
Yeah, we're excited about that.
And there won't be a mammogram
Not
vehicle
on site.
there,
Right.
but you'll get, I call them coupons.
Yeah,
Coupons.
Vouchers.
Yeah, let's go with vouchers.
Yeah. So we have a great partnership thanks to Desert View Hospital and Desert Radiology, and so they've been fantastic, and they're providing vouchers for free mammograms. I believe they've been doing it, it's valid any month other than October, just because October is Breast Cancer Awareness Month and they get really busy. So they just ask that, probably November on, you go get your mammogram and it's completely free. So we're really grateful for that partnership and their donation.
So let's look at what we're going to be doing between now and the beginning of October.
A lot.
We're going to be asking for volunteers, right?
Yes.
You're going to be hustling, and the people that are on the committee is going to be hustling for the higher end professionals, but we're going to need the people on the low end.
Hey,
like
I don't call it high end or low end. I think everyone is everyone at that clinic is important, and that's serious. I mean, you can't. It takes a village. But yes,
I enjoy what I do and work nights.
Yes.
And I love interacting with the people, so that's why
great.
I take that.
Yeah.
And there's no one rushing to take that midnight shift.
Yeah.
So as Stan Brock and we mentioned before, let's go over that again. The ramusa.org. And then what do you do then?
Yeah, so you'll just click on volunteer with us and it'll bring up the list of clinics. You'll find the Pahrump, Nevada clinic and just sign up. There will be multiple categories. So if you're a healthcare professional, you'll sign up under your respective profession. There's categories for kitchen, there's categories for facilities and maintenance, parking lot. So it like they said in the video, you do not have to be a medical professional. It takes a village. We have over 200 volunteers that put on this clinic for each year, so there's a lot of roles, and you'll get a free shirt, and a cool goodie bag that we give to the volunteers, which actually has some really cool stuff in it, and we feed you also, so you'll get breakfast and lunch.
The breakfast burritos are to die for. Not literally though, but they're great. Yes, yes.
They're pretty great. Shirley cooks in the kitchen for us, and she's fantastic.
It's well worthwhile to attend as someone who needs the services, and it's well worthwhile to be a volunteer there as well. It's very heartwarming.
Yes.
We don't care where you live. You could live in Tecopa. You could live in Amargosa Valley.
You could live in Mexico.
Yeah.
Doesn't matter.
No. Just come there and you'll be served, okay? No questions asked. So thank you, Ryan, for visiting with us today.
Thanks for having me.
And then, like I said, we'll have 3 more of these shows in the near future. Remember, We will be wearing masks as it stands today, and that's the way it's going to stand.
As of right now, yes.
Yes.
Yeah. Yep. I
And-
don't see it changing.
Right.
Yeah.
So be patient with that.
Yep.
So thank you for watching, and we'll see you next week.
Thanks, everyone.
There's my shirt.
RAMUSA.org.
Yes.